Good evening, everyone, and welcome to our Immunodeficiency Insight webinar for December. Tonight, we're going to be talking about accessing the NDIS and non-NDIS supports. We have many members asking questions about this particular topic, and so we're very excited to bring you this most recent webinar. Before I start, I would like to begin today by acknowledging the traditional custodians of the land on which we meet and pay my respects to their elders past and present. I extend that respect to any Aboriginal or Torres Strait Islander people here today. Just to provide you with a basic outline, we are going to have a presentation from Mandy Drain, who works in the NDIS sector. We will look at some of the resources that are available to you. We'll talk about upcoming webinars and events at IDFA, and then we'll ask you to do a poll to provide feedback. As many of you know, the IDFA is the peak body for people with immunodeficiency in Australia. We've been around for almost 20 years, and during that time, we've had a number of key priorities: providing education and awareness, care and support, and building a community around immunodeficiency, and conducting advocacy campaigns to drive change at health policy level. Tonight, I would like to introduce Mandy Drain, who is the Director of Tailor-Made Outcomes. Mandy has worked in the sector for many years and has helped numerous people with their NDIS applications. And tonight, Mandy is going to provide an update in terms of what's happening with the NDIS. So I'd like to introduce Mandy Drain and hand over to Mandy.
Thank you, Carolyn. Did that work, or have I got a different screen going now?
You've just got your computer screen.
See, best practice, hey. Practice, is that better?
That's the one.
Yay. Awesome. Well, thank you. I've just been having a bit of a chat to Carolyn before this presentation. Originally, when I was asked to present, we were looking at what we thought would be the rollout of quite a lot of NDIS changes. There hasn't been as many as predicted, which means I can do a little bit of time as well on the application process itself at the end of the presentation. So the outline of things that I wanted to just go over today is just a brief overview on the National Disability Insurance Scheme itself, or the NDIS, the NDIS review, and an update on what is currently being looked at, what are the changes, and a little bit about what we can predict might be coming to us soon. There's a lot of impact that's happening because of these changes, so I'll touch on them. There was some initial conversation from the NDIS about foundational supports. I'll do a little bit of an overview of them. What is the current consultation? So what is the key thing that the NDIS is focusing on at the moment, sharing that with you. Then I'll have some time to go over what it is in terms of applying for the NDIS, what you need to concentrate on, and offer some support with that. And how do you stay up to date with a system that's constantly changing? So very briefly, because I did touch on this at the last webinar, and I really want to make sure I'm giving you really useful information, not going over the same thing. But the NDIS insurance scheme, it's about providing supports to people living with disability. It is also providing supports to carers and to family members of people living with disability. So even though it commenced in July 2016, a couple of weeks ago was the first time that we were actually given any very clear parameters from the NDIS around what you can and cannot do with funding. Up until the 3rd of October, it's been a little bit vague. So that was probably one of the biggest things that's happened. And the idea of it is that we're realigning with the goal of making sure that participants are having their independence maintained and that they're given the opportunity to participate in not only in society, but also to give economic contribution where possible, build capacity and potentially enter or return to the workforce. The most used, I think anyway, jargon of the NDIS is the concept of reasonable and necessary, which is very abstract, but what we're seeing more through this review is that they're actually trying to define that a little bit more. And it's really important to note that the scheme is also looking at early intervention supports. And the scheme will look at for children. Early intervention is for children, but it's also for people that have acquired a disability. So a real focus on some really heavy interventions initially after the acquisition of disability to see if they can rebuild capacity for someone. So I'll do a little bit of a conversation on that coming up too. The purpose is to ensure that people living with disability have the same level of independence and capacity as someone without disability. It's not always possible. The scheme supports people with very profound disability. So when we talk about capacity and independence, it's always in a safe way. So the idea is that funding is provided to assist people. That could be technology, that could be direct supports from a support worker, could be in the home, could be in the community. The scheme encourages choice and control over who supports someone with disability. The recent review is changing that a little and making that a little bit firmer, and that's around the safeguarding. So I'll discuss that a little bit down the track. And so again, we've got that the idea and the purpose is reasonable and necessary. I think the easiest way I've heard someone explain reasonable and necessary is if someone without disability, well, sorry, I got it the wrong way. Because of your disability, if you get supports, will you be more on an even keel with your peers and your counterparts of around the same age and all the same parameters? And if the answer is yes, then that support is best placed for you. So what is the eligibility for NDIS? So to enter the scheme, you must apply before you turn 65, before your 65th birthday. Anyone that acquires a disability after the age of 65 is not eligible and would move across to my aged care. That's not my area of expertise, but I do know that if we meet somebody and they're very close to 65 and we think that even a fair shot at getting onto the scheme, we strongly encourage people to try, because my aged care doesn't look at capacity building. It looks at maintaining quality of life and maintaining the household and the supports, whereas NDIS has a bigger focus on equipment and capacity and keeping people out of aged care facilities as well. So another eligibility criteria is you must be an Australian citizen. There is one particular, sorry, I forgot the word for it, citizenship that hides in the background around a visa. I've never met anybody that has it, but it's somewhere deep in the legislation. So if anyone's super keen, I can send that through afterwards. You must have a diagnosis of disability, and also it must be aligned with a functional impact. What has recently come out, and it's in a slide a little bit further, is that the wording from the NDIS is changing. They're not going to look at functional impact much longer. They're going to start using the word impairment. Obviously, that has got a lot of participants as well as potential participants quite up in arms, because it is such a negative connotation. The word impairment is really not strengths-based. It's not focused on goals and outcomes, but in terms of accessing the scheme, people are now going to have to prove, and to also stay on the scheme, improve impairment. Your disability must be lifelong and permanent, and you must have a requirement for supports to assist in areas of your daily life. So this was the main part that I wanted to focus on when we decided to do this a number of months ago. But as mentioned at the beginning, the NDIS haven't rolled out the things that they said they would in any real order or at any kind of succinct pace. They have released a pathway and a plan recently that shows what the next period of time will look like. But between the release last December and now, there's kind of been a bit of drip feeding of information. It's going across the entire scheme, and unfortunately, unless you're a bit of a super sleuth, sometimes you can miss information being released. The NDIS will update one particular page on their website, or they will release one frequently asked question. So at the end of this, depending on what questions come through, I will send through a list to Carolyn in the next day or so that have all the really highly recommended websites if you're interested in joining subscriptions, because places, particular organisations such as the Disability Intermediaries Australia and Disability Services Consulting are focusing heavily on being those super sleuths. So instead of spending hours, and I'm very grateful that I don't have to do that because it would probably consume every working hour, we're relying on other bigger organisations that specialise in this type of industry. The DIA, for example, the Disability Intermediaries Australia, are also the ones championing for any change that isn't going to be in the best interests of people living with disability. So I'll send through that list because it's the only way that any of us are really staying up to date at the moment. So the biggest thing that's come out, and as I mentioned in the beginning, from 2016, the scheme has been live, but it was only on the 3rd of October this year that the NDIS released what is an NDIS support and what is not an NDIS support. It is a very clear list. Actually, it's really not that clear. It's a list that outlines what is deemed an NDIS support, what a person living with disability who's on the scheme can potentially use their funding for, and what other things that are an absolute no. So some very clear examples of no that have come out are, for example, there was a dot point for taxidermy, which everybody has found fascinating. Like, surely no, that's the level they've drilled down the nose. I have no idea where that came from, but the other things that they've pulled out as no's are things that potentially have been a grey area before. Example might be pool cleaning. They're still willing to say on the yes list you can have yard maintenance, house cleaning, but you can no longer have your pool cleaned. Whereas in the past, if you were living with an acquired disability and you previously could do that yourself, you could use some of your funding to pay someone to come in and clean your pool if you were still doing the chemicals and things. That's on the no list now. So they're very quickly, Pete, we're getting a lot of phone calls, as every NDIS provider is, asking, is this a yes? Is this a no? The pool cleaning is just an example. There are hundreds of different things that people have previously been able to access, whether or not they were best placed with the NDIS, and now they can't. They didn't give a very big rollout time for this one either as providers, and we deliver plan management as one of our 2 supports. We were given a very quick turnaround to suddenly start knocking back invoices for very specific things. So there's been a lot of unrest for people that have previously had a yes that now has a no. So there's a lot of back and forth happening. The third thing the NDIS did was develop a model called a replacement support. It's still quite clunky to really understand it in practice. What the NDIS is saying now is if you have funding and you would like to pretty much barter, you would like to give up that funding that you've been given for X and use it to do Y instead. As long as you can show evidence that it is reasonable and necessary and that it's aligned to your disability, that they will consider it. It's going to be quite a from what we're seeing, it's going to be quite a costly move to do this, because to get a replacement support across the line, you need a form to be filled out by either a medical professional or an allied health professional. So if it's allied health, you're paying them out of your NDIS plan to fill in that form. If it's medical, unless you're one of the very few that still have access to a bulk billing GP or a specialist, you're going to need to pay for an appointment. An example of a replacement support could be that a person was funded to have house cleaning. Part of their core supports was to have house cleaning. They really, really don't want people to come into their home. They want to reduce the amount of people in the home as much as possible. So they opt to barter off. Instead of having people come in, they might apply for a RoboVac. And RoboVac is considered an everyday support. So you then have to show evidence that the acquisition of the RoboVac is directly linked to the impact of disability. Watch that space. Nobody that we're supporting has gone through it in a less than clunky way yet. So hopefully they streamline that a little bit. I'll send through the links in the next day or so to all of those, to the list. They're really interesting to have a bit of a look at, a bit scary in some sense, like I said, of some of the things that are on the no list. They've really thought everything through. Ooh, sorry, I'm just going to move my face so I can't see that bit. Okay. The NDIA have decided, as I said, to drip feed information. I want to just give you a prime example of, I guess, the frustration that's coming through from providers and participants at the moment with the way that they're rolling out changes. So just under 2 weeks ago, the NDIS rolled out that they were going to change the rate for art and music therapy. They advised that they would no longer see it as a therapeutic support, and a period of time in the new year, providers who were delivering these two therapies had to change their rate to charge a much lower rate. There was a lot going on around that space, especially for children, for trauma-informed supports, a lot of arguments around the validity of art and music therapy. The agency was like, nope, this is what we're going to do. And then very late, this is what they love to do, very late on Friday afternoon, they changed their mind. So they're like, we've changed our minds. We're not going to do that anymore. So a lot of providers that were quite panicked, a lot of participants that were quite panicked, suddenly were then able to be told, oh, no, it's okay. They've changed their minds. They're going to look into it more. So I guess participants, families, providers, at the moment, it's very hit and miss. And I think that we just keep reminding participants to, if you're not sure, just keep asking. And that's a prime example of how quick things can move at the moment. The two things that are probably the biggest contenders, nobody really knows how this is going to happen yet, but the NDIA have announced that at a period in time yet to be disclosed, if you are a provider of SIL, which is in supported independent living, it's where people living with disabilities share accommodation and there's supports in the property 24 hours a day. That model of support, as well as support coordination, which is the model that my team and I deliver, where we connect people to services and supports. Anybody that delivers those two models must be NDIA registered. So this is one of the biggest concerns, I think, that's coming out, because one, we're a registered provider, and I can tell you it is not a cheap thing. We actually pay for the privilege of being audited. Still fascinates me that I have to pay to go through that. But anyway, the NDIA are about a year behind. The NDIS Commission are the ones that do the registration and re-registration. So if you want to become a registered provider, you must go through audit, and then it all gets submitted up to the commission. Your registration is then contingent on the commission signing off on it. There's a year's backlog at the moment. So anybody, if they're now turning around and saying that these groups of providers need to be registered, what kind of time frame are you going to give people? Because everyone could get it done, but if we're then waiting a year for the commission to turn around the registrations, is that going to affect people's ability to deliver these services? So that's one of the big ones we're still waiting on an answer for. The other one is around short-term accommodation, otherwise known under the scheme as respite. So that respite or short-term accommodation has always been a little bit blurry. It was never succinct enough in its wording. It is now a lot clearer that respite and short-term accommodation is for people with disability who live with a carer, who live with an NDIS. They see a carer as someone who resides in the home with the person but is not a paid support. So that's step one, whereas before there was an ability of someone who lived on their own to potentially go away somewhere for skill building, skill development. That's not possible anymore. So respite, and if you are choosing to go on respite outside of a centre-based model, so you're not sharing your respite with anybody else, there are certain things that are no longer covered, such as accommodation, food, that would be covered if you were in a group model of respite. This is one that's causing a lot of tension for participants, because in some ways it's pushing it back to the model of someone is living with disability or someone has a disability, you need to hang out with other people with disability. We are so far past that, but the short-term accommodation is kind of pushing it back into that group model again. So there's a lot of consulting going on around that. Sorry, moving it again. A big one that's come out on the 3rd of October was the NDIS have started to send out letters, not to all participants, but to certain cohorts. And I can use that word because they're looking at certain diagnoses of disability. So they're looking at clusters of diagnoses, and they're sending out letters saying you need to show that you still meet access. You need to show that even though we determined a period of time ago that you met access, all the criteria, we now want you to show more evidence, and they're flipping it. They're changing it to have different terminology. They're talking more about the impairments. So this one, they're targeting, we've seen a lot of the letters come out for children. So we're seeing a lot of children start to drop off the scheme at the moment, which is really quite concerning, because early intervention has always played such a big part in capacity building for children. What was supposed to happen, what the NDIS said when they initially announced the review was that we will do a two-prong approach. Yeah, we may find that we have to streamline who's on the scheme. We may have to tighten up the parameters for who gets access to the scheme. But what we will do is make sure that we provide more mainstream, more what they call foundational supports. The NDIS was always intended for people with what is regarded by the scheme as the highest support needs. That terminology is still being used, but there isn't a clear definition on what exactly constitutes this higher level of support needs. So what's happening is people are getting letters. They've got a period of time to submit information when people are dropping off the scheme. The foundational supports haven't been built. There is still, I've got nothing. I've actually got nothing I can show you tonight, which is really kind of hard to fathom. That is a new, innovative, government-funded mainstream support. Prior to the NDIS, there were a lot of mainstream disability supports funded through government. They disappeared when the NDIS came in. We're going back the other way for some people, but there's nowhere to go. So this is, I really wish I could give you something, but I can't. So this remains one of the really big areas that the disability intermediaries that I mentioned before, that the Disability Services Consulting are looking at as well. They're pushing back on the government and saying, you're not doing it fairly. You can't give people support then take it away, but not offer some kind of mainstream support to assist. That's all I've got on that. I'm sorry, I really had wanted to tell you that a lot of things were being put in place. At the moment, it's not, but what is in place is a lot of noise happening from a lot of people to say, what are you going to do about it? So the idea, I'm not going to touch on this too much because I want to get into giving you some time for applying for the NDIS. But the idea, as I said, these foundational supports is about mainstream supports that are accessible, inclusive, and bring it back to community, to supporting people with disability under a model other than just the NDIS. Over the last few years, everything by default seem to just get funneled towards the NDIS. Whereas if we can get some of these foundational supports in place, maybe people won't need to be restricted by entering the scheme and they'll have other options. I hope that if I get a chance to do another webinar in the future, I can actually present some of them to you, because my dream is that there will actually be some in place. So as I said there, since the announcement in December 2023, nothing has actually emerged around this yet. So, and finally, the NDIS are constantly releasing consultation papers. They're asking people to write in, to ring, to do whatever they can to give information over on certain things. And the one they're looking at the moment is around penalty frameworks, and the onus is starting to move towards providers, and especially registered providers, who are not doing the right thing, who are not abiding by the code of conduct, who are putting people with disability at risk of harm. There will actually, the proposal from the Commission is that there will be civil penalties. So there will actually be financial penalties that align with WHS penalties now, with WorkSafe penalties at the moment. They are also looking at increasing the way that, well, not increasing it, but having heavier penalties on fraud reporting. In our organisation, I would probably on average across the year do 1 fraud report a week. There sadly are not enough safeguarding measures in place to stop people from taking advantage. The idea is if they can put more safety measures in place, that this will hopefully reduce. They do publish, which is always an interesting read, a banned providers list. The NDIA will release a list, and it pretty much names and shames people that have been found to have breached the code of conduct. I mean, these are serious allegations, and inside of that, people are banned from life for supporting people with disability, or they're banned for a period of time. So these ones are the ones that are being looked at the moment. So I think we've got another month or so, don't quote me on that, might be a bit longer, to kind of talk through how we feel about these changes. I think anything we can do to put more safeguarding in around people living with disability and the scheme, it's going to be beneficial. Carolyn, can I just check timing? Sorry. How am I looking?
Yeah, look, we've got time. There are a couple of questions in the chat, but feel free to go for another few minutes, no problems.
Okay, thank you. So I'm always happy for these to be sent out afterwards. So just to going quickly over the application process, and as I've said to Carolyn before, I am more than happy for you to reach out to me directly if you would like some support with accessing the scheme. As a registered provider, the rules have changed and I can no longer submit an application on behalf of someone else, but I can, with consent from whoever is sharing that information, review it, or have one of my team review it, give you some advice on if we think you've hit what needs to be hit, or give you some ideas on maybe go back and have a look at getting this information, get it all ready for you, but then you would need to submit it or have someone you trusted who isn't a registered provider submit it. So there's 6 categories, and this is where it gets interesting at the moment. Just quickly, this is seen as functional impact, which is how you enter the scheme. They're now sending out notices of impairment. So we've got 2 contradictory wordings happening, but until they change the access requirements and they change the way the access form is filled in, we still have these 6 categories. So you don't have to hit all of them, but you need to hit a couple and show how it impacts. So communication. So these examples were given to me last time when I did the last webinar. And so I've just left them in there, but I thought if anyone had any questions at the end of this, any more specific examples, I can send some more through as well. But it's looking at communication and how the impact of disability affects your ability to communicate, social interactions. I think of that more as social isolation. And if the disability wasn't impacting, would you by choice go out and do more, but you're actually unable to? Learning new skills, acquiring new skills without support, this might just be too challenging for somebody. Mobility, I think the big one that whoever was on the last webinar you spoke about on that was that, you know, you might be able to physically access public transport, but the risk of infection from crossing over with multiple people from the community might mean that you cannot risk that. So you are actually isolated. Self-care, those areas of daily life, and managing a household, managing all the tasks associated with living, basically. Evidence of treatment, I do strongly encourage for anyone making an application where the disability is a little bit harder to prove and you want to show the NDIS that it's not health that you're going for, that it is functional impact. Show examples of everything that's been tried, show the length of time, show that you tried it, but it wasn't successful, or it was successful, but you still have functional impairment. I have a really good template that one of my team saw, so I can share that. You can get guidance from GPs, allied health professionals, specialists, geneticists, reports from your hospital admissions. I'm very conscious in saying all of that, though, that the top 3 require funding. They require you to pay someone, and that is really challenging. So if you want support to see about entering the scheme, please don't reach out before you go and get any new appointments or anything, because I'd hate to think you've gone and paid for something if maybe there's enough evidence already. And if not, hopefully somewhere down the track, these foundational supports will assist. You can also write an impact statement of lived experience. I think they're quite powerful. I don't know if the NDIS pay them much attention, to be honest. They're really based on allied health medical professionals. All applications must be submitted through the same pathway, which is through a local area coordinator. I'll send all these slides out. If you meet access, you have a meeting, you talk about your goals, what support you need. We make sure, well, the LAC makes sure that it isn't something that can be funded through mainstream supports, and then a first plan with funding is released. If you don't make access, you can request a review where it's someone else in the NDIS reviews it, or if that doesn't go through, you can go to the tribunal. You can resubmit at a later date. You can explore mainstream supports, as I said, when they come through. There's a couple, but I will add some more to it. I find staying on the NDIS website is a great way of just, because they keep updating it and they just sneaky little updates for us. And yeah, hopefully I've kept it in the time for you.
Thank you for that, Mandy. That was a wonderful presentation, and there are so many changes and nuances about the NDIS. We're very grateful to have you assisting us with providing information that's clear and concise for our members to potentially use.
You're welcome.
I do just have a couple of questions here for you.
Yes.
The first one is, how does one get started in applying for the NDIS? What is the first steps, and then the following steps?
Yep. So the first step, there is a very specific application form that I would usually say to people, ring the 1-800 number if you're able to do a phone call. I can send this out if you like afterwards for sharing. You can ring the NDIS, say you would like an application form sent out, and that gets posted out to you. You then take that to a medical professional and they fill in parts of it, or you bundle up what evidence you've got. The diagnosis is important, but it's the functional impact that's more important. You bundle it all up and submit it all along with the first few pages of the application process, and an assessor will have a look at it. There is a really big delay at the moment in responses to applications, so you can submit it and then you can add further evidence to it as you go along. If you do get declined the first time, you will be given information on why it was declined, and that kind of gives you a bit of a framework for what other information do you need to go back and get to.
I guess, Mandy, for the benefit of our members, is there any way that members can meet with someone in advance of putting the application in to give them the best chance of providing what is necessary and being successful with that application?
You can. That's something that quite a few providers will do. Usually providers like ourselves that don't do any direct supports at all. The other option is that you can talk to a local area coordinator. I'm a little bit hesitant for that because it's a lot of personal information you're handing over at that initial stage. You could ask an advocate to assist. Unfortunately, advocacy support is a horrific wait list at the moment as well, because people are fighting other things in the tribunal that needs advocacy. So look, if you've got a connection, if you've got someone that works in the NDIS and you trust them to have a look over it, otherwise, yeah, feel free to reach out. We're happy to assist as we can.
Thank you, Mandy. I think we'll just continue on with the presentation and we may come back to some more questions towards the webinar. So now I'm just going to show a media clip that was done with one of our members, just to show their experience with the NDIS.
On the surface, a loving mum and her 2 kids take their family dog from what you don't see in Oxford.
So, with illness, actually fixed a diagnosis. About a decade of just being unsure of exactly what was causing different symptoms of that.
From symptoms leading to a CPID diagnosis, and while Harry's out enjoying the fresh air, she can also symptoms of infection and most others.
I now get regular immunodeficiency. So I receive that via a podcast in my chest every 4 weeks. And the way the doctors have described it is, it will not stop me getting infections and viruses, but it is likely to stop the catastrophic life-threatening infections.
It's struggle existing NDIS support.
The assessor that I had was saying that my symptoms are all related to illness rather than disability, and therefore the feedback that I received was that I just wasn't going to be eligible.
Yeah, as part of World Primary Immunodeficiencies Week, a step-by-step guide, including simple language so that it explains all the different terminologies and also provides parameters as to how to write applications so that applications is successful.
It's helpful just to be able to look at how to communicate in our application process how the disease is debilitating and how it actually disables us.
The free resource is available for everyone in hard copy and PDF. London.
So just looking at some of the resources, and that particular resource that was referenced in that media article is available from IDFA. We can send you a hard copy of that, or you can access that via our website. And so it talks about all the different terminologies that Mandy's mentioned here tonight, and it provides some clarity about how you can go about applying for the NDIS, and there are some templates in that document as well. As mentioned, Mandy will work with us, continue to work with us, and we will look at developing some templates as the changes are made within the NDIS to ensure that our members have the most up-to-date information that is required. So I think for this evening, that is the, let me just check the questions again. Yes, so we just had that one question. If you do feel as if you would like to, as if you would like to send in more questions, please do so. And you can send those to our info email, and we will endeavour to provide you with answers. We'll continue to work with Mandy as our NDIS partner so that we can ensure that you've got the information that you need, access to resources and information that will hopefully assist you to be successful in accessing the NDIS. While I'm talking now, I'm just going to launch our poll feedback. So can I just ask you to take a couple of minutes to complete those questions while we finish the webinar? So in finishing off, obviously, I'd like to thank Mandy. Mandy, we've had a great relationship throughout the course of the year. Mandy's done a couple of webinars for us, and she's provided significant input into that booklet that we've produced, which we think is a fairly innovative partnership between an organisation such as ours and an NDIS provider. So we'll continue to review that booklet and work together to ensure that we can support our members in the best possible way. And I'd just like to thank all of you for attending our webinars this year. We've had a really busy schedule of webinars. We've delivered 12 webinars this year, all of which are available on our website. And this one will be sent out to all registered members in the next couple of days before we close up for Christmas on Friday. In 2025, we've got another exciting series of webinars starting on the 27th of February with our Rare Disease Day webinar. So as you may know, Rare Disease Day is a World Day of Action around all types of rare diseases. The day is actually the 28th of February. So we're hosting a webinar in conjunction with our partners AusPIPS, who are another partner organisation, and that will happen on the 27th of February. So as we approach the end of the year, I'd just like to wish you all the best for Christmas, the new year, and I hope you have a lovely break and festive season. Do feel free to get in touch with us if you do need information or support over that time. We will be monitoring our info email and our 1-800 number as well. So we're always here to support you. Again, thank you for attending tonight. And Mandy, thank you particularly for your presentation. Good night, everyone.